Hi there, my name is Natalie Westfall and I'm a mental health and addictions nurse with the Erie St. Clair CCAC. I'm here to talk to you today about youth and opioids, a topic that's been in the media a lot lately. As a positive influencer, you can help identify youth at risk, help them connect to the services that they need, and help to keep them safe. Opioids are a group of drugs generally used for treating pain. Some occur naturally using a substance collected from the opium poppy. Some are semi-synthetic, and others, like fentanyl, are fully synthetic. They come in many different forms, such as pills, liquids, patches, and lozenges. Youth are often prescribed opioids after dental surgery. It is not uncommon to see a prescription for 30 Percocet tablets following wisdom teeth removal. With each tablet's street value of $5, you can see how it could easily become diverted into the wrong hands. Youth believe that it's safer to get high on prescription medication versus street drugs because they came from a doctor. Unfortunately, when teens are using these medications, they're often taking much higher than prescribed doses and are crushing and snorting the pill. Dependence develops from repeated use of a drug and results in withdrawal upon stopping. Addiction is compulsive, out-of-control drug use, despite negative consequences. We know that teens are more likely to become addicted because they experience intense gratification in the reward centers of the brain. Carfentanil has been in the news a lot lately. It was created for veterinary use to sedate large animals such as elephants, but has now made its way into the underground market. It's often imported from China and often online. As you can see in the picture, the small amount of white powder next to the penny indicates a lethal amount of this dangerous substance. You will likely recognize the street name of most opiates, like Oxy, Perks, Dilly. If you hear another name you don't recognize, you can always plug it into urbandictionary.com to find out what it might be. As you can see from these Canadian facts and figures, we're prescribed more opiates in North America than anywhere else in the world. In 2015, 10% of Ontario students reported non-medical use of opioids in the past year. Opioids were the second most commonly used substance after cannabis, and among students who reported their use, 72% reported that they obtained them from home. Opioids have also been a hot topic in our local media, and it's no wonder. Our opioid use rate in Windsor-Essex is 7th highest in the province. The Windsor-Essex County Health Unit released their report on local opioid misuse earlier this month. The findings showed that males aged 20 to 44 accounted for nearly half of all opioid-related visits to the emergency department in 2015, and an increase for this reason in general. The rate of opioid deaths has increased 189% between 2007 and 2015. These could be some warning signs that your teen is using drugs or is at risk. If they suddenly lose interest in things they once enjoyed, like sports or social activities, if they're falling behind in school or missing work, if cash, valuables, or medication are missing from the home, if they're using cash advances or payday loans, if they change friend groups suddenly, if they're being deceptive, secretive, or lying, if they often leave the house for short periods of time or friends come to visit for short periods of time, they might be going to pick up drugs or sell them. If they're sleeping excessively or at atypical times of the day, if there's a notable increase in snoring, constipation, and sudden mood changes. The last could be a sign of intoxication or withdrawal. If you suspect that your teen is using opioids, there are some signs that they might be intoxicated. If they have constricted pupils that don't react to light, droopy eyelids, sluggish responses, appearing drowsy. Also, when people are snorting drugs, their nose is congested, they may lose their sense of smell, they have nosebleeds, and their voice might be hoarse. When someone is in withdrawal, they often have flu-like symptoms, including cold shakes, chills, sweating, fever-like symptoms, mood swings, anxiety and depression, bone pain, vomiting, insomnia, and diarrhea. So what do you do if you suspect your teen is using or is at risk? While you can educate yourself on the signs and symptoms of opioid abuse, pay more attention to where they're going and who they're going with. Keep a tight control on the medication in your home. Talk to your teen's friends, parents, teachers, coaches, and know what community resources you have available. Spend quality time with your teen and get to know their friends. Reinforce their positive behaviors and remind them often that they're loved. Be aware of their cell phone and online activity, and most importantly, talk to them. If you have regular conversations about drugs with your teen, they're more likely to come to you if there's an issue. Sometimes we think we're helping someone with addiction when really we're enabling their behavior. This is most often done by close family members and friends. Examples of enabling behavior are giving them money, making excuses for them to others, calling in sick to school or work for them, paying their bills. If they don't suffer the consequences of their addiction, they might not be as motivated to change their use. If you need to keep medicine in your house that has the potential for abuse, like opioids, benzodiazepines like Xanax or Ativan, or stimulants like Adderall or Concerta, keep it locked up. I implore you to collect all the unused medication around your house and return it to the pharmacy for proper disposal. Encourage all the people in your teens' lives to do the same. If you are prescribed an opioid, be discreet about it to minimize the risk that it'll fall into the wrong hands. It's also important to note that when you go to obtain your medication from the pharmacy, you can dictate how much of it you want to take home. So if you get a prescription after wisdom teeth removal for 30 Percocet tablets, you can take 5 or 6 and just say you want to just use it for the next couple of days and then see how it goes. If you want to know for sure if your teen is using drugs, you can bring them to your doctor, a community health center, or a clinic for a urine drug test. You can also perform the test at home by ordering the kits online at drugtestkits.ca. Naloxone is a medication that can reverse an opioid overdose. It doesn't require a prescription, just the intervention of a pharmacist to explain how to use it. Talk to your pharmacist if you're currently using opioids, if you're a past user who's at risk for relapse, or if you're a family member, friend, or another person who might be in a position to assist someone when they're having an overdose. All secondary schools in Windsor-Essex have services available to help students who are struggling with mental health and addiction issues. Simply talk to your teen's principal, vice principal, or guidance counselor to access these services. The University of Windsor and St. Clair College also have support for students. The Mental Health and Addiction Nurse Program that I'm a part of has nurses in all the secondary schools in Windsor-Essex. We may be the first point of contact for a youth who's using drugs. We provide safe and confidential support, education, and system navigation in school, at home, or in the community. You can refer to our program through your teen's school or call us at CCAC directly at 310-CCAC or 310-2222. We encourage parents and caregivers to seek out support for themselves when they're dealing with their child's addictions. It can be a tremendous strain on the entire family. There are multiple agencies who provide family support, including Teen Health, Brentwood Recovery Home, and Hotel Dieu Grace Healthcare, and more. For more information, please visit the Windsor-Essex County Health Unit's website or call the Drug and Alcohol Helpline at 1-800-565-8603. Finally, thank you to Banna and Positive Influencer for giving me the opportunity to share this information with you. Take care.